Okay, this week I'm doing, for chapter 24, I'm doing question number 2, which is discuss how the World Wide Web has affected the way consumers seek health advice and health care. What skills should consumers possess to evaluate websites for accuracy and credibility? Well, as we know, since the 1990s and probably a little bit before that, the World Wide Web has pretty much exploded, and now everybody is seeking advice online, whether it be good or bad. So it's our responsibility as healthcare providers to guide our patients and their families to the appropriate websites and to teach them how to find the appropriate websites. Okay, um, so I mean they have access via computer, via phone, so many different ways that most people can get access to the web. Um, in the book, they talk about on page 484 how consumer health has evolved, and the personal health information needs to be for the consumer needs to be expanded. And there's basically 10 levels of um, which healthcare consumers or e-patients access and use health-related information. Level 1 is to search health information. The consumers engage in search and rescue missions related to their newly diagnosed diseases and disorders. Okay, so basically they're going to be using search engines like we've been discussing over the few weeks to find and narrow down their information. These activities are not limited to themselves but also geared toward helping others. According to the Pew Internet and American Life Survey, more e-patients search for medical information for friends and family members. Yes, that's true. Think about how much you've done for your friends and your family members. Let's see. Level 2, they kind of exchange email with family members and friends. They kind of like spread out and say, okay, this is what I found, and this is what I found out whether or not it's true or not. Okay? So they can email and they can network. And level 3 is to seek guidance from online patient helpers. When confronting a new healthcare issue or condition, consumers may seek out and communicate online with another patient and who has experience in the same condition. You see a lot of people doing that too with like breast cancer awareness website. Level 4 is participate in an online support groups once they have confirmation of their diagnosis, or they'll, like if they're spreading out and trying to figure out whether or not this is them or not, they're kind of confirmed with that group whether or not that's true or not. Let's see. Excuse me. Let me get this right. Let's see. Level 5 is join with other online consumers to research the shared concerns. So level 5 is going, they're stepping up the game. They're actually they've already been talking to groups. Now they're talking to other people who have the same kind of concerns as they do. And then level 6 is to use online medical guidance and systems. Online healthcare consumers can access websites where they can enter the names of all the drugs they are currently taking and receive information of all possible drug interactions. When really, they can also do that through their pharmacy also. So we can also guide them that way too. And level 7 is to interact with volunteer online health professionals. And level 8 is use the paid services of online medical advisors and consultants. Could be healthcare providers. They need to be for secondary opinion. It could be also, I think they're insurance companies too, because a lot of times your insurance companies have uh, um, sites and providers that they can help guide you. Also, their benefits packages. I know some of my benefits packages will have like a nurse call you and to help follow up with like online weight loss or maybe your diet control, those type of things. Level 9 is to engage in electronic conversations with their local clinicians, which we were discussing also about going across state lines and all those type of things. You can be local. I mean, usually it's local physicians or local healthcare providers, nursing. And then level 10 is to receive one-way electronic messages from their clinicians. And kind of trending that way, it's going to save people a lot of money, both patients, families, and providers. to provide care, they can actually reach out to you a lot easier sometimes than actually you coming into the office. I know with my mother in Nuvant, she can access all of her lab results and those type of things via the internet and her online access. It's really helped her quite a bit since she is disabled to be able to gain access to everything right there at her fingertips. And she can communicate with her doctor that way also. So it's helped a lot. Um, and that's my answer to question number 2. Thank you.